Good morning, everyone. I'm Grant King. I just want to go over some things and talk a little bit about the COVID-19 situation in our country. I have to be honest with you, some things are really, really bizarre. I think most of us kind of know that. And even from the very, very beginning, this whole thing struck me as being really, really strange because we were doing something that's never really been done before, and that is we were quarantining healthy people. That's never been done. There have been cases like with the Spanish flu where certain venues were shut down because so many people were sick. But the stay-at-home lockdowns, this has never been done before. The idea behind quarantines has always been you quarantine sick people and let the healthy people go out and live their lives. Another thing that seems really strange now is you see that many states are not reopening, that are not reopening, have a statistically insignificant number of cases. Now, where I live here in Knox County, Tennessee, we are reopening, and they're being careful, and I really want to commend our elected officials. It seems like they're taking a cautious approach, but the goal seems to be that they are wanting to get everything reopened and get people moving back again, but they also don't want to come back and suddenly have a disaster and find out that it really wasn't going to be a good thing. But I want to talk about the numbers here for a moment. This is what was yesterday. I've got it pulled up. This is, yes, most of the counties have been doing updates. This is what Knox County has. Now keep in mind, Knox County has nearly 500,000 people. Actually, according to the website, 456,185. There have been 307 positive cases. 233 of them have recovered. Currently, there are 69 active cases. 37 people have been hospitalized. Currently, there are 2 people in the hospital. And we have had 5 people pass away. Now, just to put those numbers in perspective, I had it all one time worked out, but basically, the deaths have been 1 out of 100,000. And I mean, obviously, that is not insignificant to somebody who just lost a loved one. But on a statistical level, that is an insignificant number. Currently, we have only 2 people in the hospital. And but that's what this has been about. So then, I would also like to point out the CDC puts out a daily update as well, and it's very, very confusing. Because on one column they have COVID-19 deaths, then they have pneumonia deaths, then they have deaths with pneumonia and COVID, influenza deaths. It's rather confusing. But one of the things that's rather interesting is that we've only had about 6,000 flu deaths. Now, in a normal given year, we would have somewhere between 30 and 70,000. I believe in 2017-18 flu season, we had about 81,000 people passed away from the flu. This year we've lost 6,110. But now here would be a question: is with this pandemic, there's a column here called percent of expected deaths. In other words, what we would normally lose due to mortality rates at this point in time in this country. Now, one would expect with the COVID pandemic, we'd be significantly higher, possibly maybe 120%, 130%, maybe conservatively, maybe 110%, but we would have definitely gone up. I'm going to show you the chart. This is from yesterday. I printed it off. I don't know if you'll be able to see it or not. Under percent of expected deaths, we're at 99%. It hasn't made a dent in the mortality rate in this country. We are pretty much right exactly where we would normally be anyway. Now, then there's also the talk about how the CDC, how people are coding COVID deaths, that people may have died of other causes, and if they had COVID-19, that the deaths are being coded as COVID. That was actually stated by Deborah Birx at the Presidential Task Force. But I want to read something. This is from the Vital Statistics Reporting Guidance. This is guidance for certifying deaths due to coronavirus. This is from the CDC itself. I want to read one paragraph down here. This is the concluding paragraph. Now, I want you to get this. An accurate count of the number of deaths due to COVID-19 infection, which depends in part on proper death certification, is critical in ongoing public health surveillance and response. When a death is due to COVID-19, it is likely the underlying cause of death, and thus it should be reported on the lowest line in Part 1 of the death certificate. Ideally, testing for COVID should be conducted, but it is acceptable to report COVID-19 on a death certificate without this confirmation if the circumstances are compelling within a reasonable degree of certainty. So literally, they don't even have to have tested for COVID-19. So that's one thing. Now I want to go into the other side about the models. Well, remember when they first came out with the models and they said what was going to happen if they did nothing, we might lose 2 to 3 million people to COVID-19. And then if they did do the lockdowns and the shutdowns, we might lose between 2 and 300,000 people. Well, we haven't lost anywhere close to that. And the only reason we've got the numbers, and the numbers that they're actually reporting, because of the way they're reporting, really don't mean anything. They're meaningless numbers. We have no idea how many people actually died because of COVID-19. But one of the things is, here's the thing about models. And I'm not in engineering, but I've studied stuff and I've had to do stuff where I've dealt with being in construction. I've had to deal with engineering. When you do a model, it's kind of like a long equation. You take one number out of the equation, the answer is going to be completely different. And that's the same thing with these models. If you take a number out or take a factor out, it's going to be completely different. Well, one of the things is I was hearing this whole thing over the last 2 months. There was one thing that was completely missing in all of the equations, in all of the models. Nobody took into account the fact that we do have an immune system. You have a natural immunity, particularly if you're healthy, your body's going to try to fight this thing off. So, give an example is now there was a meme going around that said part of the danger about this. Actually, it wasn't a meme; it was a post copied from a friend that said basically the reason that this thing was so dangerous was because your body doesn't recognize it, because it was a coronavirus, a SARS virus that came from animals, and your body doesn't recognize it. That's not how the immune system works. The immune system doesn't have to recognize something as a virus, as a specific thing. It recognizes that it doesn't belong. It's the same situation that happens when people get organ transplants and they have to be on anti-rejection drugs or cosmetic implants. Your body's going to try to reject it. Not because it doesn't recognize it, not because it recognizes it. It recognizes that it doesn't belong. It's not part of your body. And so it's going to try to reject it, and it's going to try to fight it off. Same thing with this virus. It doesn't have to recognize this specific COVID-19 as being a virus. It knows it doesn't belong there, and it's going to try to fight it off. Now, the thing is there was plenty of anecdotal evidence to suggest that all along, particularly from the Diamond Princess, where people were stacked in at a population density. A friend of mine calculated out with the floor space on the decks and the number of people on board. The population density was about 100,000 per square mile. Very, very dense, and they were all interacting with each other, all dining together and everything. And they all got tested. And only 19% of the people on that ship tested positive. 81% never tested positive. So the immune system fought it off in their case. The USS Theodore Roosevelt had a higher percentage of people test positive. Of course, on an aircraft carrier, it's much denser even than a cruise ship would be. You don't get a private room on an aircraft carrier, maybe unless you're the captain. So anyway, the thing is that there was enough anecdotal evidence there to say that your immune system was going to fight it off. And the thing is you've got a lot of doctors now out there saying herd immunity is the way to go. It's not just one lone voice, but they've been largely being ignored. Now, an interesting thing about herd immunity is there's no money in prescribing it. Doctors don't make money in saying go out and gather with people and live your life, and this thing will pass through. So why would a doctor prescribe herd immunity? Well, one of the things is they're talking about getting a vaccine for this thing. If they ever come up with a vaccine for this coronavirus, it'll be the first time in history that there ever was a vaccine for a coronavirus. It's never been done. And because of the nature of coronaviruses, it's virtually impossible because they mutate and they're very unstable viruses. And so being able to actually nail down an actual virus or vaccine is going to be it's going to be a daunting thing. Once they come up with a vaccine, the virus will have mutated into something else and it won't work. Maybe it's the fact that these doctors actually understand that having an effective vaccine is really a fool's pipe dream. It's not going to happen. So now, as far as I want to talk just a little bit about the conspiracy theory end of it. And I don't really like to get into conspiracies, but I do have to wonder something here. Because, first of all, we did something that has never been done before. And it's only been about 9 years since we had the swine flu outbreak back in, what was it, around 2009, 2010, somewhere in there. And we had a lot of deaths from that. And they did not do the lockdown thing. And this whole thing about the lockdown, this is a brand new thing. But what really, really puzzles me about it is it wasn't just our nation that did it. It was virtually the entire developed world did it, with a few exceptions. So how do you get everybody on the same page so quickly and everybody agrees this is what we're supposed to do and they all do it? It all kind of points out that there is a common source to this, that somebody is taking their cues from a single person or a single group. I would also submit to you that the person to blame for that is not China. Nobody was listening to China, and everybody knew that, but they are listening to somebody. Who? I don't know. If there's a young journalist out there wanting to make their career, perhaps that's something you could investigate. So anyway, just wanted to share some thoughts. Hope you're all safe, and hopefully we'll all be able to get our country going back together. Sorry this was kind of quick and kind of jumbled, but hope it was helpful. We'll talk to you soon. Bye.